A 55-year male presents with complaint of pain abdomen and jaundice. Now we start scanning from epigastrium, placing a probe in transverse direction and see the left lobe of the liver. Here we see the duodenum, an echogenic gas and shadow of these gases. Here we see a continuous echogenic line with shadow in the duodenum at epigastric area. Below the duodenum, we see an echogenic area and hypoechoic area. This is a portosplenic confluence. Here we see the splenic vein which join the portosplenic confluence. Around the portosplenic confluence is echogenic area. This is pancreas. Below the confluence is uncinate process of pancreas and left side is head. Here we see the body and tail of pancreas. The pancreas is echogenic, but size appears to be normal, within 2 centimeters. Now we clearly see the splenic vein. The pancreas lies above the splenic vein and around the portosplenic confluence. When we slide the probe from epigastrium to downside, first we see the left lobe of liver, then duodenum with gases if normal, and below the duodenum is pancreas. For scanning of pancreas, it is better to scan first portosplenic confluence with splenic vein, and it is easy to locate the pancreas around and above the splenic vein and portosplenic confluence. Because pancreas is difficult to locate due to gases. Now we see the left lobe of liver, which shows heterogeneous structure above hypoechoic or below hyperechoic texture. The margin of lobe of liver are also irregular, which shows some chronic infection. Here we see a nodule, and on color Doppler we see no flow in the nodule, but peripheral flow is present. Here we also see a ligament venosum. This is remnant of umbilical cord which is converted into ligament venosum. Now we will measure the size of focal lesion. It is a well-defined rounded heterogeneous mass and isoequivalent to hyperequivalent mass. The size of mass is 19 into 20 millimeter. Now we scanning the right lobe of the liver and scan the focal lesion or pathology in the right lobe also. Here we see another echogenic well-defined rounded mass. This is well-defined rounded echogenic mass or focal lesion. Now we will measure the size of this mass. The size of this mass is 13 into 14 millimeter. Now on color Doppler we see no flow in the mass but peripheral flow is present. Here we see another echogenic focal lesion. This is echogenic lesion and on color Doppler minimal flow is also observed. Here we also see hypoacutic area at subdiaphragmatic area. Now we will measure the cranocaudal view of liver. For cranocaudal view, we will place probe at right lumbar area and direction will be towards to the left lobe of the liver, and we will take the maximum size of liver. The size of liver is enlarged 18 centimeter or 181 millimeter. The normal size of liver is up to 16 millimeter. Here we see an echogenic line which is a diaphragm, and also we see a hypoechoic area between liver and diaphragm which is fluid collection or ascites. Now we will scan the portal vein. Here we see the portal vein, and there is also an isoechoic mass in the portal vein at porta hepatis, which is a thrombus. Commonly, the thrombus is present in the portal vein at severe chronic liver disease. As we see the heterogeneous structure of liver with irregular margin and multiple focal lesion. Now we will see the resistance inflow of portal vein due to thrombus. Here in power Doppler, we see the resistance inflow or disturbance in flow of portal vein due to thrombus. Now we will measure the size of portal vein at its middle part at pre-thrombotic area. Here the size of portal vein is 9.7 millimeter. The normal size is 12 millimeter. It means there is partial flow in the portal vein or partial obstruction in the portal vein due to thrombosis. Now we also measure the thrombosis. The size of thrombosis is 37 into 16.9 millimeter. Now we will scan the gallbladder. The gallbladder is partially filled or partially contracted. The walls of gallbladders are thickened. If we focus on the walls of gallbladder, we see three layers: internal layers, middle layer, which is muscular layer, and outer layer. These walls are appreciated when there is chronic inflammation of gallbladder wall or chronic viral infection as due to chronic liver disease. The walls of gallbladders are also edematous or structural changes in the gallbladder walls. When gallbladder walls are normal, only single echogenic layers are seen. Here we see the diameter of gallbladder wall is 10 millimeter due to thickness of walls. No stone or mass seen in the gallbladder wall. Now we scan the right kidney. The texture of kidney is normal and no stone or mass seen. And this is left kidney, which shows normal texture of cortex and medulla. But here we see a well-defined cyst in the cortex. No septation or debris seen in the cyst. Now we will measure the size of cyst. The size of cyst is 20 into 23 millimeter. Here we see the spleen. When liver texture become coarse, the splenic texture will also coarse due to inflammation. Now we will measure the size of spleen. The splenic size is 111 millimeter or 11 centimeter. The normal size of spleen is up to 12 centimeter. It means splenic size is normal. Now we will scan the pelvis. Here we see fluid and echogenic gut loops which are floating in the fluid. Here We see a bladder which is partially contracted. Now how we will write report. Liver is enlarged in size 18 cm and shows heterogeneous texture with irregular margin, multiple focal lesions of variable sizes and texture present in the right and left lobe of the liver. Portal vein is normal in size 9.7 mm and a large thrombus 37 into 13 mm present in the portal vein causing partial obstruction at porta hepatis. Gallbladder walls are also thickened 10.7 mm but no stone or mass present in the gallbladder. Both kidneys are normal in size and texture. A simple cyst size 23 into 20 mm present in the mid-pole of left kidney. Spleen is normal in size 11 cm. Mild to moderate amount of fluid present in the abdominopelvic cavity. Urinary bladder is partially filled. The ultrasound diagnosis is chronic liver disease with focal lesion in the liver, adenomyomatosis, and portal vein thrombus with mild ascites and left renal cyst.